Hi, this is Jane Salmon, and I am interviewing Graham, who is an air conditioning engineer, and we are sitting in Kensington Gardens, London. Hi, Graham. You had a hip surgery, correct?
I did, yes.
Yeah, was that just on one hip or two?
No, it was on one hip. It was on my right hip.
On your right hip?
Yes.
Okay. And what made you decide to get surgery?
Basically, I was involved in an automobile accident. Somebody hit me from behind while I was stationary, and they shunted my knee into my steering column, and as a result, that shunted basically my whole leg and destroyed the cartilage in my hip. And as a result, within a very short period of time, I was virtually unable to walk, from being used to climbing on ladders and going on roofs and everything like that. I could barely walk 50 feet in the end.
Oh, wow. And how long was that progression from having the accident to not being able to walk, approximately?
Just a couple of months.
Really?
Yeah, as quick as that.
Okay. And then when you couldn't walk, like you could only walk 50 meters or feet?
50 feet, yeah.
50 feet, yeah. How long was it before you got the operation?
It's about 2.5 years.
2.5 years.
Yes.
And what was the wait? What made you decide not to have it immediately, or wasn't that an option?
Well, at first I went to the hospital and they just said, "Oh, give it 6 weeks. It should be okay in 6 weeks. You know, the injury won't probably be that bad." Within 3 months, I was in extreme agony, and they said, "Oh, well, sometimes it takes a little bit longer." And then after about 6 months, it was unbearable. I couldn't get in or out of my vehicle hardly. If I got out of my vehicle, because I was then by that stage almost bone on bone, if I got out of my vehicle, I'd have to actually stand up for about 5 or 10 minutes just to get my leg into some sort of position where I could start to move. And then basically it was about, as I say, about 2.5 years
before you had the
before I had the operation. In the end, it just became unbearable, and they did eventually put me in for an emergency operation.
Wow. And so you had this done in England, right?
I did, yes.
Yeah.
It was actually meant to be under the NHS.
Okay.
But because the NHS had quite a long waiting list, they decided to put me in privately, funded by the NHS.
Okay, fine. And did you do any research or do any sort of pre-operation physical therapy or any? Did you go through any acupuncture, anything at all?
I went through physiotherapy before the operation, but that didn't help at all because by then I was, as I say, bone on bone.
Okay.
I did a lot of research because I was looking, I forget the name of the research that I was looking for, but it's where they basically do injections. I think it's either an injection into the cartilage. They did like a silicone, forget the name of it.
Cortisone?
Now. Cortisone, that's the word I was looking for, sorry, yeah. So I did a cortisone injection, that didn't help. And then I was looking at another type of surgery where they somehow do some sort of injury or something where they make blood drip into the cartilage.
Oh, yeah.
But because the cartilage, sorry? Probably, yeah. So, but by then the cartilage was so badly destroyed, they said it would never happen. It would never repair itself or anything like that. That's only ever any good if you get it sort of quite in the early stages. So then basically I had to go through the various different consultants. And
how many consultants did you go through?
I went through 2.
Okay.
The first one, they wanted to do the surgery, but they wanted to go through the buttocks, and I'd been advised that was not a particularly good way to go. It's quite an old-fashioned way because the healing process was a lot longer.
Yeah.
And he said, basically, we only go through the buttocks and that's it. So I decided not to have the operation. I went back to the hospital and said, look, I want a different consultant because I wasn't happy with this particular consultant. So they gave me another consultant who said, oh no, we don't do that, that's an old-fashioned way, we're going through the side.
Okay, so you didn't have the posterior one, and is that because it cuts through the buttock muscle?
That's right, yes.
Okay.
And it takes about 3 months to 4 months, sometimes longer, depending on each person, to get better from that.
Yeah, okay. And so so then you had the anterior one, the one in the front side?
Yeah, that's correct, yeah.
Yeah, and how was that?
That was absolutely fantastic. I had a spinal anaesthetic, I didn't get put under, and if you don't mind noise, I'd probably personally recommend that to anybody.
Yeah.
What they did was they gave me a numbing injection first of all.
Yeah.
Before they did the spinal.
Yeah.
And I didn't feel the spinal at all. And I was able to be awake through the whole operation,
Wow.
which I found quite relaxing. In fact, I actually naturally dozed off to sleep for about 20 minutes while they were doing it.
Okay. And then after the operation, when you were in the hospital, how long were you in hospital for after the operation?
I was in hospital for 3 days. They took me to the recovery ward. I was there for about 40 minutes. Lovely sandwich.
Okay.
And, so I was able to eat straight away after the operation, where with the normal anaesthetics, where they put you out, you quite often can't eat for quite a few hours afterwards. So I was quite happy with that.
Okay.
They took me back to the ward.
Yeah.
By then it was late afternoon, so they didn't get me up the first day.
Yeah.
The next day they got me up and they showed me how to walk with crutches.
Yeah.
On the third day,
How far could you walk on the first day?
Well, on the first day I was quite surprised really, because I was able to walk the full length of the ward.
Yeah.
I was in basically a private room, and then they had the corridor. I walked right the way along up to the corridor, which was probably, I would say, about 200 feet.
Okay. And was someone walking with you? Or
Yeah,
near
they
you?
were guiding me and showing me how to walk with crutches and how to do that properly. And then the next morning, I didn't realise, because I wanted a shower. So unbeknown to me, I was meant to have somebody walking with me all the time while I was in the hospital, but I was up early because I get up very early, and I went and had a shower on my own at sort of 6 o'clock in the morning.
Okay. And how was that? Did you?
That was fine. Yeah.
Did you have to hold on to things when you were in the shower?
There was a rail in the shower room, so I went and did that. I had a bath in my own room, but I didn't feel comfortable getting in and out of the bath.
Yeah.
So I decided to have a shower.
Yeah. Okay, and then by the second day you were walking.
But that was on the second day. So the first day I had the operation. The second day I was walking. On the third day I was doing stair training.
Okay, so how many stairs?
I think I probably went up about 10 stairs.
Okay.
And learned how to go up and come down.
With help? Like with someone standing there?
They stood with me, yeah. They showed me what to do, and then I did it on my own.
Yeah,
and
was that difficult?
I found it quite comfortable. It was just okay. Before the operation, I'd already practiced walking up and down stairs and getting the movements, because I'd researched what I needed to do and the type of exercises that I would have to do.
Okay.
So I'd already practiced how to sort of come up and go down.
Okay, so by day 3, then you left on day 3 or 4? Fourth day.
I believe it was the evening of day 3.
Okay.
Yeah.
Okay, and then when you got home, what did they recommend that you have certain things in your place ready for when you got home?
Yeah, I did. I had to. The toilet seat had to be raised. The settee had to be raised, and the bed had to be raised.
And how did you do those things?
Well, I live on a narrowboat.
Yeah.
Okay, so the toilet wasn't a problem. I just put some blocks underneath it, because we have portable toilets on the boats.
Okay.
The settee, I made some blocks to go underneath, and that raised it up about 6 inches.
Okay.
And my bed, because it's a cabin, it was already quite high anyway, because I've got lockers underneath, so the bed wasn't really a problem.
Okay. Okay. And in terms of pain levels while you were in hospital after the operation, what sort of pain medicine were you on?
Right, so when I was, before the operation, I was under a lot of medication.
Yeah.
But
pain medication?
Sorry?
Pain medication.
Pain medication, yeah. So NSAIDs, things like ibuprofen and things like that, and amitriptyline.
Yeah.
So when I had the operation, they gave me, I forget the name of the tablet, but it was to stop blood clotting.
Yeah.
Okay.
Yeah.
They also gave me painkilling tablets.
Yeah.
But the pain after the operation wasn't as bad as the pain before.
Yeah.
So I took the tablets while I was in hospital, and
Yeah.
after about 3 days,
Yeah.
I basically cut all the painkilling tablets out.
Okay.
And I kept taking the anti-blood clotting tablets with omeprazole.
Yeah, which is what?
Basically, it's like a Gaviscon type of stuff. It's just to help the inside of your stomach.
Oh yeah.
Yeah, so
to
it has
prevent the lining from, being damaged. Yeah.
So I had a omeprazole, so I took that, and I can't remember how long I had to take that for, but as soon as I was off that, I was pretty much off the painkillers.
Okay.
The first day, when I got home, I walked probably 200 yards.
With crutches?
With crutches. It
Okay.
took me ages because I was getting used to the crutches, and also I was slightly scared about the hip because obviously they'd only just been done.
Yeah.
The next day was a completely different story. I felt more confident walking on it, so I walked about half a mile. That took
2 days after coming out of hospital?
Yeah, 2 days after coming out of hospital.
Wow.
With crutches?
That was with crutches, yeah. And that took me about an hour and a quarter to walk the half mile, just walking slowly, but it only took me 45 minutes to get back because I was a bit more confident then.
Yeah.
After 3 days, I was walking about a mile, just under a mile.
Yeah.
With 2 crutches.
Yeah.
And then after about a week and a half, I went down to 1 crutch.
Yeah.
And after about 10 days, I was able to walk. Sorry, no, that's not right. After 10 days, I was able to walk about 3.5 miles a day.
Wow.
And that was with 1 crutch.
With 1 crutch?
Yeah.
Okay, and then how long before you gave up that crutch?
I had to feel confident in giving up the crutch, so I would say possibly 6 weeks.
Okay.
6 weeks.
Wow, that's very good.
You know.
And in terms of driving, so obviously you drive and you drive with your job as well.
Yeah.
How long before you started driving? Around the car park, for example.
Yeah, basically around the car park, and just to get used to the vehicle, it was about 3 weeks, 4 weeks, and then I felt quite comfortable driving. So I technically, I mean, there was no official limit of when I could drive. They said when you feel that you can do emergency stop in your vehicle.
Yeah.
So what I did was I came along through the embankment road, because as I said, I live on a narrowboat, and I drove towards the river, and I thought, if I can't make an emergency stop, I'll finish up in the river. So I stopped, and I felt comfortable doing it.
And you're a good swimmer, I presume?
Yeah, I used to be a lifeguard. So I decided then that probably now was the time to do short distances on the proper road. I felt comfortable with the brakes, stopping, the changing gears, using the accelerator, everything like that.
And so that was after 3 to 4 weeks?
That was after about 3 to 4 weeks. And by 6 weeks, I was driving normally again.
Okay, good. Okay. And did you do, other than walking, did you do any sort of other rehab exercises, or did anyone come to you, or you go anywhere for like any specific physical therapy?
Yeah, I mean, basically they gave me a sheet of exercises to do, which I can't emphasise this enough. It's really important that you do the exercises because the exercises, as tedious or tiring as they might seem at the time, really do give you your strength back in your legs.
Okay, and what sort of exercises were they?
They were mainly stretching exercises.
Can you show me a couple now? Would you be able to show me one, or?
Yeah, I could, but I need something to hold on to, really. Well, I mean, I can explain it. I can explain it to you. Basically, what you do is you hold on to the side of a table or something that's about waist height, and you bring your leg backwards, and then you bring it forwards, and then you rest it. Another one is like a semi-squat, but where you extend your leg backwards and go down until it's comfortable, and then hold it there for a few seconds and come back up. Other ones are squats, normal squats, which most people know, where you go down. And that's just a few of the exercises.
Okay.
The other thing that I found, which was quite interesting, was although you can practice your exercises before and after, one of the biggest things is actually having the confidence to walk up the stairs. Because although you did stair training, it's, how can I say, it's very important to get the confidence back in the hip. It's important to get the confidence back in the hip. Yes, excuse me, you can hear somebody's looking at a dog here.
Yes.
And what I did was I took all the weight on the leg that had the hip replacement. So where I could walk up comfortably on one hip, I then had to take all the weight and put it onto the opposite hip, you know, the one where I'd had the hip operation, and feel confident that it wasn't going to suddenly give way underneath me.
Okay, yeah, that makes sense.
And there were some very shallow steps, so I started off with those, and then shortly afterwards I went on to normal steps, and I found that once I'd started to lift my leg, it was such a pleasure to be able to walk up and down the stairs naturally without having to use crutches, and to know that I could put the weight on both legs again without being in pain.
Yeah. And so now, how long is it since you had your op?
About 18 months.
Okay, and life before was that you couldn't walk 50 feet. What's life like now? What can you do that you couldn't do before?
Oh, I can virtually do anything now. You know, I can cycle. I mean, I for a long time I couldn't cycle. That was hurting. I can do little short bike rides now. Walking, I can still walk quite well, but I do get tired occasionally. I won't say that I don't, because I do, and occasionally.
Does your hip get tired?
My hip doesn't so much get tired, but where I was walking awkwardly for 2.5 years, I found that my knee on the opposite side was giving me problems.
So you were compensating.
So I have to, because of compensating for the bad hip. So now what I have to do is basically, if my leg starts to hurt, I just have to take it back, and just ease up a little bit.
Yeah. But is life sort of back to normal now, or was it like?
No, I don't think it's ever going to be back to normal. It's never going to be able to do the things that I used to be able to do. I mean,
such as?
Well, for instance, I liked skiing.
Yeah.
I've got a motorbike. I don't feel confident riding my motorbike anymore. I don't feel confident skiing. I will try and go back to skiing.
Yeah.
But the motorbike, I'm probably going to have to sell that, because it's quite a heavy bike, and if it fell on me, I just think that would ruin everything that's been done.
Yeah. Can you jog or run at all?
I've tried to run a little bit. I have done a little bit of running, but I find it hard. And I was also told that actually swimming or cycling would be better than running, because when you run or you jog, you're putting stress on the hip because you're pounding down on it.
Yeah. So it's an impact.
Yeah. So I just decided that I would probably try and cycle and swim.
Yeah.
So I've recently joined a gym, so I can start swimming again and try and get some strengthening exercises back into it.
Yeah. And do you feel that because you could only walk 50 feet that your muscle strength went at all before the op?
Oh yeah, definitely, without a doubt.
Yeah.
It made me very tired.
Yeah.
The pain made me tired, and the muscle strength definitely wasn't what I used to have. But I feel that gradually, slowly, I'm starting to get it back.
Oh, good.
I don't think it'll ever be 100%, but if I can get it back 70-80%, then that's better than not having it at all.
And can you get up ladders?
I can do, yeah. It's a bit of a struggle sometimes.
Yeah. Because of your hip or because of your knee or strength, muscle strength?
A bit of both, really. It's not not so much the strength, but it's just that it can sometimes hurt because I've tried to avoid all ladder work now.
Okay.
I try to do small things rather than.
Yeah.
I've had to adjust the way I work.
Yeah.
And my whole lifestyle, but
was it life changing, the operation, or not?
It was life changing that it took me out of pain.
Yeah. Okay. And looking back at that 2.5 years when you were in like really bad pain, could you have had the op sooner if you wanted to?
I could have done, but it would have meant having that posterior op, and I didn't want that.
Yeah. Okay.
And it took me a long time to, obviously just because the way the system works, for me to get another consultant.
Yeah. And were you nervous about having the op? Did that play any part in you holding off at all?
I was nervous, yeah, and it did play a part in it, but
what made you decide to definitely have it in the end? I know you went into emergency.
Because at the end of the day I was just in so much pain, I thought I can't go through the rest of my life like this.
Yeah.
Fortunately, my father had a hip operation, and he told me, he fell down and broke his hip, but he told me after the hip operation that he was fine, and I saw the way he moved around, and he was in his 80s at that point. So I thought, well, if he can do it, so can I.
Yeah, okay. And is there one last thing you would like to add in terms of if someone is thinking about having an op and they're very nervous or worried about it, is in terms of timing or anything?
I'd say in
Or
terms
any
of timing,
advice?
you definitely have to push your hospitals or your consultants to try and get done as soon as possible.
Okay.
Because obviously that limits the damage to your hip.
Yep.
But secondly, I would say that don't be scared of having it done, because it really will transform your life.
Okay. All right. Thank you, Graham.
That's
Really
all right.
appreciate it. Thank you. Wish you the best of health going forward.
Thank you.
Okay. Bye.
Bye.